Ready for medical career growth? Yes, you are in the right place. Hello, this is Dr. Neema Bish, BDS by degree and a pharma professional. As a founder of CareerInPharma, our mission is to guide medical professionals towards remarkable success in the pharma industry. With a track record of over 700 plus students trained and placed into various premier pharma companies, we are here to elevate your journey. Hello everyone. Once again, I welcome you all to CareerInPharma. Now, in today's video, we are going to discuss another important interview question for pharmacovigilance profile, for freshers profile. So, this is another video in continuation with our series on pharmacovigilance important interview question answers. Yeah. So, in today's video, we are going to discuss adverse drug reaction and its classification. So already I gave definition of adverse drug reaction in my last video. Today I am going to focus more on the classification, which is one of the important interview question for pharmacovigilance. Also, I will explain you in such a way that no need to mug up the things. It will be very easy to remember the things. Yes, this I give you a promise. Yeah, so that kind of explanation I am going to give you. So again, I want to make a revision. What is adverse drug reaction? So definition of adverse drug reaction. So that I was talking about. So according to WHO, any response which is noxious and unintended, right? Like I already explained in last video, in last series of this pharmacovigilance important interview question. So it is any response which is noxious, which is unintended and which occurs at a normal dose which we are using in humans for prophylaxis or for diagnosis or for treatment, therapeutic dose or to alter the physiological function. Okay, so any noxious unintended response which occurring at all these doses is known as adverse drug reaction. Now, classification of adverse drug reaction is another important interview question, and there is a very important classification of adverse drug reaction which is given by Rollins and Thompson. See, there are many classifications of adverse drug reaction given by different people and based on different criteria. But this classification by Rollins and Thompson is the most important one. You should be understanding it. You should be remembering it for interview. Yes, and whenever in interview they are asking classify adverse drug reaction, so you can give this answer which I am going to describe in this today's video. Yeah. So adverse drug reactions classification, these are of 5 types. Yeah, this Rollins and Thompson classification, there are 5 types of ADR. Okay, in fact 6. That is type A, type B, type C, type D, type E, type F. Okay, so this is 6. A, B, C, D, E, F. Okay, 6, fine. Now very easy to remember. A, type A for augmented, B for bizarre, C for chronic, D for delayed type of adverse drug reaction. I will explain exactly what is this delayed and all those stuff. E for any adverse drug reaction which happens at the end of treatment. F for failure of treatment. Any adverse drug reaction happening because of failure of treatment. So very easy to remember. Okay, no need to mug up. Ratta marne ki bilkul zarurat nahi hai. Very easy. Again, 6 type. A, B, C, D, E, F. Augmented, bizarre, chronic, delayed, end of treatment, failure of treatment. Yes. Now, type A, which is augmented. Augmented means any adverse drug reaction which is already known. So it is very easy to understand what kind of adverse reaction will be already known, which will be based on the pharmacological effect of the drug, which is happening because of the pharmacological property of the drug. That will be the known and the augmented type of adverse drug reaction. So as these are always known and happening because of the pharmacological property of the drug, so it will always be dose dependent. Yes, means if we increase the dose of this medicine, this type of ADR will also increase. Yeah, so it is directly related to pharmacological property of the drug. So it is a known augmented type of ADR. Example, insulin. So insulin we are using to treat diabetes, right? And in diabetes we want to decrease the sugar level. So insulin definitely doing hypoglycemia, but hypoglycemia with insulin is a augmented known adverse drug reaction, because if dose are not correct, then your sugar might go very less. So in that case you may encounter hypoglycemia as well. So insulin with hypoglycemia is an augmented kind of adverse drug reaction which is dose related and which is known and which is happening because of the pharmacological property of the drug. Because insulin का काम ही है शुगर को कम करना, तो अगर डोज सही नहीं होगी तो you may encounter hypoglycemia ADR as well. Another example is bleeding with anticoagulants. Again, anticoagulants का क्या काम है? Anticoagulants का काम है जो भी blood clot बनते हैं उनको तोड़ना, right? Sort of, I would say, you may say it is a blood thinner, right? जो blood को पतला रखते हैं और clot नहीं बनने देते हैं body में. So, अगर इसकी dose भी ज़्यादा हो गई, then you might face bleeding also. So this is directly related to the pharmacological property of the drug. Yes. So two very basic example: hypoglycemia with insulin, bleeding with anticoagulants. It's a augmented kind of ADR. Now augmented kind of ADR की remedy क्या है? Remedy ये है कि हम dose को reduce कर सकते हैं, और अगर कोई ऐसी concomitant drug है जो कि इसको और बढ़ा रही है, then we can stop that concomitant drug as well. Yes. So dose, because it is dose dependent, by decreasing dose we can treat, we can prevent to this ADR to happen. Yes. Now type B kind of adverse drug reaction is a bizarre kind of reaction. So bizarre का मतलब होता है something happening, बहुत ही अजीब चीज होना जिसका हमें रीजन नहीं पता है. तो B for bizarre, which also means strange thing which is not predictable, unpredictable, and can occur in any patient at any dose. Because we don't know why it is happening, it is very unpredictable, that's why it may happen to any patient at any dose, and this is type B, that is bizarre kind of adverse drug reaction. A very common example, hypersensitivity reactions or anaphylaxis with penicillin. So if you know pharmacology of penicillin group of antibiotics, then hypersensitivity and anaphylaxis is very common with penicillin also. It is which is unpredictable. Till now we are not able to predict why it's happening. So it's a bizarre kind of adverse drug reaction. Similarly, bone marrow suppression with chloramphenicol is also one of the bizarre kind of adverse drug reaction where we don't know at which dose it is happening, to which patient it is happening, and why it is happening. Yes. So remedy for type B, that is bizarre kind of adverse drug reaction, is only one, that is we have to stop the drug and we can avoid that drug in future. For example, if you are giving any patient penicillin to treat their infection and if you see there is some anaphylaxis or hypersensitivity reaction, immediately stop the drug because you don't know why it is happening. Only remedy is to stop the drug. Yes. Now another type of adverse drug reaction is type C. C for chronic. C for chronic. So chronic, meaning of chronic is anything which is happening from a longer time. We have chronic disease which happens from a longer time. Chronic medicine we have to take it for a longer time, right? So anything occurring because of long-term use of a drug. So type C, chronic type of ADR you will not able to see with small duration. You will be able to see this type C, chronic type of ADR with long-term use of drugs. So all the drugs which used for chronic diseases, in that you can see, with those drugs you can see this chronic type of adverse drug reaction. Very common example is adrenal axis suppression with corticosteroids. So in many autoimmune and in many chronic conditions, corticosteroids are in use. So adrenal axis suppression can happen with these corticosteroids long-term use. Yes. Another, analgesic nephropathy with diclofenac. So if you are taking diclofenac on a regular basis without any doctor's prescription, please don't use it chronic. Don't use it on a long term. Just whenever required, take then only. So because analgesic nephropathy is seen with long-term use of diclofenac. So these are the example of type C chronic, which we can see after the long-term use of these drugs. Remedy, the drug should be given in lower dose and with shorter duration, or alternate therapy can be used. Now type D kind of adverse drug reaction is delayed. Delayed. So this type of adverse drug reaction occurs after a time lag. Means I have taken the medicine now and after 2 to 3 years I can face the adverse drug reaction. Okay, that is the time lag. Or maybe I have taken the medicine now, next year after stopping, next year I just saw some adverse drug reaction. So that is which occurs after a time lag. Very common example is carcinogenicity and teratogenicity. There are many drugs, medicines which causes carcinogenicity, and there is teratogenic effect also because of that drug. Yes. Also, one of the very famous example is chloramphenicol, grey baby syndrome with chloramphenicol. That is a delayed type of adverse drug reaction. Now, remedy for this type T, delayed type of adverse drug reaction is use the drug only if really required. Yes, if it's really required, then only use this kind of drug. Yes. Now, type E kind of adverse drug reaction. E stands for end of treatment. So, adverse drug reaction which happening when you stop the drug, when you end the treatment. So, it occurs at the end of the treatment and when the drug stops abruptly. It may seen at the end of the treatment or when the drug stops abruptly. That's why many medicines are there, many class of medicines are there which we can't stop abruptly. We have to reduce it gradually by decreasing the dose. For very most common example is withdrawal reaction with opioids. So you can't abruptly stop opioids. Yes, there should be dose reduction. And people who stop opioids abruptly, you will have withdrawal reactions. Another very important example, common example is rebound hypertension with beta blockers. Yes, and another example is withdrawal seizures when anti-epileptic drugs stop abruptly. So that's why you must have seen that patient who are in epileptic treatment, or maybe patient who are on anxiety treatment. Okay, these drugs, doctors, they start prescribing with low dose, gradually they increase the dose, and when they are about to stop the treatment, gradually they will decrease the dose and then they will stop. They will not abruptly stop. So don't think that why doctor is doing like this and I should stop it abruptly. No, never do this and follow protocol of your doctor. Yes. So these are adverse drug reaction which is happening because of the end of the treatment. So remedy is always taper the dose before abruptly stopping the drug. Type F. Now last one is, that is F. F is happening because of the failure of the treatment. So any adverse drug reaction which happening because the treatment failed, the treatment did not work. Yeah. So it occurs because of failed treatment. Example is pregnancy happened due to failure of oral contraceptives. Now contraceptive we are giving to prevent pregnancy, but if pregnancy is happening due to failure of oral contraceptive, it means this contraceptive did not work, contraceptive failed. Yes, so it happens in many drug interaction cases. When you use oral contraceptive with antibiotic, it may reduce the effect of oral contraceptive, and in many cases it happened that oral contraceptive failed and pregnancy occurred. Yeah, so this is one of the example. Now remedy is always check for the drug interaction if you are using any concomitant medicine along with the main medicine. Yes, so these are the kind of adverse drug reaction, Rollin and Thompson classification, type A, B, C, D, E, F, 6 kind. Augmented, desire, C for chronic, D for delayed, E for end of treatment, F is failure of treatment. Another classification of ADR is based on the severity. Severity means mild, moderate, severe. So in which category it's falling, based on that we will tell this ADR is mild, this is moderate and this is severe. So mild one means which is self-limiting. We don't need to give any treatment for that. For example, rashes, itching, redness. Yeah. Moderate kind of adverse drug reaction is where still manageable. Maybe you need to give some medicine, but yeah, it is manageable after giving medicine. Example of moderate class of ADRs are like vomiting, tachycardia, bradycardia. Last is that is severe. The severe adverse drug reaction is something, if you don't treat it, you may face death also. Yeah, so serious reactions may happen. That is the severe kind of adverse drug reactions. So in this, urticaria may happen, death may happen. So this is the classification of ADR based on the severity of the ADR, and the type A and F is the classification given by Rollin and Thompson, depends on the nature of the drug. Yes, so these are the important classification which you should be knowing if you are going to give interview for pharmacovigilance profile at a fresher level. Even if you are experienced at that level also, you should be knowing these two important classifications. Yes, so I hope I was able to make this classification simple for you. I hope now you don't need to mug up. You will be very easily able to remember it. Okay, once again I am going to revise it. One is Rollin-Thompson classification of ADR, where we have from type A to F, augmented, bizarre, chronic, delayed, end of treatment, and then failure of treatment. Another classification based on the severity of the reaction, that is mild, moderate, severe. Yeah, so that is all about today's video on adverse drug reaction and its classification. I hope you will be able to remember it now, and it's more easy. And if you really like this content, if really I was able to make it simpler for you, then please don't forget to subscribe to our channel. Please don't forget to share our channel with your friends. Yes, so spread it more so that we can help more and more people in this journey. Yes, and all the best for your interview. Yeah, so with this, I'm going to conclude this video. We'll be coming soon with some fresh next video. Till the time I come again, till that time, please stay safe, aware, healthy, updated, and keep exploring new things. Have a nice day.